That's a good one. John, let us know when we're ready to go. We're live. All right. Go ahead. All right. Here we go. Good afternoon, everyone. And I want to thank all of you for joining us here at one of the Paramount buildings this afternoon. And please allow me to spend the next 5 or 10 minutes to talk about what Paramount is doing in order to assure you that your loved ones are being cared for within a Paramount building. My name is James Cox. I'm the CEO and president of Paramount. And while I'm not the president of the United States, I think that my job is as equally as important to all of you, because we are here to make sure that we have the staff and the systems in place in order to take care of your loved one that currently resides within one of the Paramount properties. So I guess to start off, what I plan on doing this afternoon is to talk to you about what we have done here at Paramount in order to make sure that your loved one is safe, to make sure that all of our staff members that work in all of these buildings and care for the residents that live here are also safe, and we are protecting them as well. So one of the things that I want to start off with is, as we've had a busy 2 weeks, and as it relates to the COVID-19 and the coronavirus, I'm sure that all of you are aware that this is a difficult time for all of us. It is a difficult time for those of us in healthcare as providers. It is very difficult for us primarily because the people that we are caring for in healthcare are those people that are the most vulnerable to the virus, and the outcomes obviously can be something that we don't want to have to announce to anyone. So I think the big thing that I want to make sure that I convey to all of you is our heartfelt thanks. So you know that we appreciate you allowing Paramount and the Paramount team to care for your loved one in one of our buildings. I can't say enough about that. I don't want to deviate from COVID-19, but on a personal note, I had a family member, being my father, in one of our buildings a few years ago, so I understand what all of you are going through. Whenever we look at some of the things that we had to do last week as it relates to the announcement of the pandemic that we have in this country and in this world, was to make sure, number one, the first thing that came into my mind was, how are we going to protect the people that live with us? How are we going to make sure that they are safe? How are we going to make sure that moving forward from the day of the announcement that we have a pandemic, that all of our patients that we provide healthcare to are safe, they're eating well, they're comfortable. We want to make sure that they're happy. And the biggest thing is to make sure that all of their healthcare needs are being met. I know that whenever we talk about the patients and the population that we serve, it's very important that we maintain the level of care and the systems that we have in place to make sure that everyone is happy. And one of the things that we had to put into place as of last week that I'm sure has been a challenge, not only for all of you, but for our staff and for me as the owner of Paramount, is restricting the access to our buildings from outside vendors, from families and visitors, and make sure that we have a system in place to assure the safety of all of our patients. So as of last week, one of the things that we had to do first and foremost in protecting all of our patients is to restrict the visitation from all people to our buildings, with a few exceptions. Within those exceptions, in order to gain access to any of our buildings, what we've done is we put a system in place to, first of all, address the staff members that are coming to each building and caring for the patients that we serve. One of the things that we did was to make sure that anyone gaining access to the building, first and foremost being the staff, we are making sure that we ask a series of questions, which is a nursing assessment, to make sure that there are no complications based on some of the questions that we're asking. The second thing that we are doing is for anyone that gains access to the building, we are taking a temperature. And if that temperature falls outside of acceptable criteria, then that person would not be permitted to gain access to the building. We want to make sure that we are monitoring any symptoms that anyone would gain, for anyone that would gain access to the building. So we've got a series of questions that we're asking, as well as the physical assessment being the temperatures. And that at that point, if they pass those criteria that we have set in place, then they would be able to gain access to the building. As I said, first and foremost, the staff that are needed in order to care for the patients that live here, to cook for our residents and patients that live in our buildings, to make sure that the building remains clean, and just to make sure that everything that is a standard of Paramount remains consistent. So I think that with what we're doing within our buildings, I think that we are managing that very effectively. I think that one of the things that we are talking about this week is making sure that everybody has the opportunity to talk to our family members. And we are implementing a new system that we are going to put in place, and we're going to roll that out this week. And what it will do is to give everyone the opportunity to come to the building, and they will report to a specific area on the outside of the building. And we've got a system set up. So basically, you're going to be able to visit with your loved one. It won't be face-to-face, but it will feel like it's face-to-face. We will be talking about that in the next few days to come, and we'll make sure that we get those appointments scheduled so that everyone can come to the building and participate in that process. Another thing that we have restricted from this point forward is the communal dining program. So everyone that lives within our buildings will be able to stay in their room, and we will serve them 3 meals a day in their room. One of the things that we want to make sure that we're doing as positive test results come back within this country and within the region is to make sure that, once again, we are eliminating all risk, or as much risk as possible, to make sure that everyone is safe. So we believe that it's important to make sure that we keep everyone as contained in their living space as possible. That doesn't mean that the people that live here are not capable of coming out of their rooms and walking through the building and enjoying the community space that they have in the past. But we're going to try to, as much as possible, have activities within their rooms. One of the activities that we're looking at is having the residents come out in the hallway and identifying who their neighbors are. Who lives on the right side of them, who lives on the left side of them, who lives across from them. And make sure that we're trying to keep everybody up to speed with current events, making sure that they're aware of what is going on within their lives, within their families' lives, and just what is going on in this world today. We don't want to cause concern and give the patients that live here and residents that live within Paramount information that would be negative. And we certainly don't want to cause that disruption. And we're very concerned of the psych issues that could come about from continuing to talk about the negativity that's going on. So we want to make sure that we're upbeat. We want to make sure that we keep everybody aware as much as we can as what is going on within this world and within this country. But we want to make sure that we continue a lighthearted program, a lighthearted thought, and care for everybody as we have in the past. We've not seen anything in any of the buildings that have caused us concern. We are making sure that if we have residents and or employees that have any symptoms, that we make sure that they are seen by a medical professional and we deal with those things accordingly. I can say today that we have no positive test results for any patients or residents that live with us. We have no positive test results for any employees that are caring for any of our patients and residents. So that continues to be a good thing. I think that we were very responsive last week as we were identifying what we needed to do once we heard about the pandemic. So I think our early response and our active system implementation has been very effective for all of those involved. So I'm very proud to say that today, that is the update and the status of the residents and patients that live with us, as well as our staff members. We will be conducting an update similar to this on a weekly basis as we go. I want to make sure that all of you have the opportunity to hear from me directly what we are doing as a company to make sure that your loved one is safe. We want to make sure that your loved one is being cared for. We want to make sure that your loved one is eating 3 meals a day. And those things are so important. And we want to make sure that we're motivating the staff that is here to take care of those patients and residents. And we want to make sure that we continue the happy theme of Paramount. Whenever I started the company back in 2004, one of the things that I thought about and one of my drivers was how do we make sure that the patients and the seniors of this country and of the communities that we serve are proud to say they live in a Paramount building. You work hard all of your life, you pay the mortgage, you take care of your family, and we want to make sure that whenever you're no longer capable of doing that independently, that there is a place to come to like Paramount, that you, your family members, the people that live here are proud to say that they live at a Paramount senior living property.
Can you talk a little bit about why you're qualified to continue to manage a scenario like this?
We have in our resource base, we have a group of professionals that lead me and give me advice on how we should handle any specific scenario that we would be confronted with in order to deal with. I have an extensive background in healthcare. I've been in healthcare all of my adult life, and it lends to the relationships that we have been able to effectively develop. So while I am not a physician, and while I don't have all of the answers, I have the resource and the team behind me in order to make recommendations and to help us move forward in a pandemic such as this.
Is there anything that family members or the community abroad can do to help us in a situation like this?
So we're always looking for those people that are supportive. We are always looking for people that would help us on a consistent basis to make sure that we're spreading the word of what Paramount is doing, who we are, some of the things that we are doing that is unique to the industry, and just being a resource. One of the things that we're going to have to do very quickly is to communicate to the communities that we serve. So what I'm looking for is your support. What I'm looking for is anything that you can advise us and to recommend to me and to our team to make the lives of the patients and the employees that we serve a little better. So we're always open to talking. We're always open to listening to you. And I certainly want to make sure that we keep those lines of communications open.
I think another really important thing that people are wondering is, at this point, is there any sort of timeline as it relates to the visitation policy? How is that working?
As far as what we're looking at to relieving the restrictions that we have in place, I'm still unsure of what that is going to look like. We're going to follow national and statewide recommendations. We always want to make sure that we are in compliance with whatever it is that our federal government, as well as regulators, that make sure that we are doing the right thing from a compliance perspective. So we certainly will take those leads and make sure that we take those under consideration.
I think those were the big questions that people wanted answered initially. Obviously, there's a multitude of questions that people are having, and every question is a little bit nuanced. What is the best way that family members can get answers to their specific questions on a building by building basis?
I think the most effective way to handle that is to contact your executive director of each location. That individual is the most knowledgeable about what we are doing. That individual is the most knowledgeable of our capabilities and how we can handle many situations. If that person isn't aware and they don't have the answer for you, they certainly know how to get a hold of the corporate and regional team in order to find the answers that you are looking for. So please, I urge all of you to reach out to the executive director if you have additional questions and if you have things that possibly you think would help us. We're looking to make sure that we continue this process and everybody is cared for the way they ought to be.
If people want to stay up to date as with Paramount as it relates to COVID-19, can you tell us how we can continue to communicate via live stream and how we should do that?
So we will publish on a weekly basis the opportunity for all of you to participate in this type of a scenario. We are making sure that we afford all of you the opportunity to ask questions as it relates to this live stream, and we will continue to do that. I think that one of the things that we want to look at is at a minimum doing this on a weekly basis, but as the need necessitates, we may look to do this type of an interaction more frequently. And again, once again, the big thing is to make sure that we're communicating with all of you so all of you know what we are doing. We all want to make sure that you know that your loved one is safe and being cared for.
Okay. Thank you very much for your time.
Great. Thank you all. I appreciate your support, and we will be talking soon again. Thank you and have a great afternoon. We already did our drinks.